Okay, thank you for coming to this SPARC seminar. We have today two presentations from James Cherrington on his book, Mountain Biking, Culture and Society. After that, we'll have some questions and answers. And then we'll continue with the second presentation by Mike Thelwell on advanced body measurement techniques, whether or not they can complement current methods of cytotoxic chemotherapy dose prescription. So we'll start with Jim, and unfortunately he cannot be here, so the presentation will be online. Thank you.
Thanks, Dennis. Hi, everyone, and thanks to those of you that have joined the Zoom call today for this presentation. It's great to see some all too familiar faces, Donna in particular, and some not so familiar faces on the call. And I've never actually met you, Mike, either, so it would be good to hear the kind of research you've got going on at the moment. And I hope that if there are some scientists on the call that you bear with me, because this is going to be very different to Mike's presentation in that regard. I just wanted to say thank you to you as well, Themis, for putting up with me these last few days. I did a COVID test yesterday, and I've got COVID, so thought it'd probably be best to stay at home. So thank you to Themis for accommodating me and for allowing me to do this online rather than face to face. The whole point of my session today, of course, as you can see from the slide here, is to present or to release, I guess, to launch my book, my edited collection, Mountain Biking, Culture and Society. And that's actually going to be published on the 25th of January, I believe, of this year. As I normally would, I haven't yet had the chance to get a discount code for the book. But if you're looking for a superb birthday present, maybe even a Valentine's gift for a loved one, you can get the book currently or pre-order the book on the Routledge website for the small sum of £104, I think it is. However, if you're not in the market for a book on mountain biking, you can, of course, access it via the library, where I'm going to be ordering a copy. Like I said, the point is to launch the book. But before I do so, I just wanted to contextualize the research that I've been doing over the last few years and how that led to the book by just telling you two really short stories about mountain biking, because I think these do a really good job of contextualizing some of the issues that are in it. And what I'm going to do is I'm going to tell these stories in lieu of any kind of textbook definition of mountain biking, because looking on the call today and thinking about some of the people that might want to watch this after the event, I expect that most people will know what mountain biking is. And in the case of someone like Donna, for example, I've already bored them to death about my interest in this, and they probably have absorbed some idea about what mountain biking is. So I don't really want to get into any kind of textbook definitions. I'd much rather set the scene using a much more interesting story or a narrative. Just before I do that, I just wanted to mention that this is the first of a couple of book launches for this book. If there's anybody on the call or after the event that would like to come to another more detailed book launch, where we've got contributors to the book as well as myself introducing some of the issues that are contained within the chapters, you can do so by registering using the QR code at the bottom of the slide here. That's on the 18th, so next Thursday, if you're watching this in real time, at 6 o'clock in person and online at Sheffield Hallam University. We've got some chapters being presented there by Tom Campbell, who's talking about sustainable mountain bike trails. We've got Leslie Ingram-Sills, who was the lead on the British cycling bid recently around electric mountain biking, and Tavis Smith, who's calling in from Canada to talk about Indigenous and settler relations and how they can be remedied in some cases through trail building and the riding of said trails. Okay, so two stories, like I promised. The first is from someone we'll call Julie. I met Julie on I was doing a talk for what's called the Mountain Biking Instructor Award Scheme last year around some of the work I do with an advocacy group, Peak District MTB. And Julie, of course, who was a pseudonym, was one of only probably 2 or 3 people in the room that day I was doing this presentation out of about 40 people. And this is something I wanted to come back to a bit later on. But on a more positive note, Julie was telling me in this session about how she actually uses mountain biking to actively change the lives of young people, specifically those with disabilities and mental health problems. And what I found really fascinating about my discussion with Julie, which I guess is especially prescient given the kind of risk-averse nature of most contemporary societies, is that Julie was doing this by deliberately, but of course responsibly, exposing these individuals to risk on mountain bikes at their request. So what these kids were essentially doing was pushing boundaries on their bikes, on their mountain bikes. They were stepping outside of their comfort zones. They were doing small jumps or sessioning berms, which are kind of banked up corners that we build on mountain bike trails. And what this allowed them to do is that it allowed them to experiment with a form of physical activity that in many cases, a lot of them had never really had the chance to engage with. Now, of course, some of the riders crashed. Some of them got a few cuts and bruises. But what Julie was saying to me was that when she asks for feedback, the vast majority of these riders who attend these sessions say they feel empowered by this chance to take control over their bodies and use their bodies in ways that previous interventions and activities that they'd been on hadn't really allowed them to. And I don't know about you, but I just think that's great. I think that's lovely. So that's the first story I wanted to tell. The second is a chap who we'll call Mark, who again is a pseudonym for reasons that you'll clearly understand shortly. And I met Mark while I was interviewing people about electronic mountain bikes a few years ago. Mark was in the military, and on his tour of Afghanistan, he'd stepped on an IED, which, if you don't know, is short for an improvised explosive device. And fortunately, Mark didn't lose any limbs during the explosion, but he's now got significantly reduced mobility in his legs, so can't ride a traditional bike, therefore. Now, Mark used to be mad for mountain biking, used to do it all the time, it used to be a big part of his life, but now, for obvious reasons, he was struggling to participate in ways that he would like, and that, it goes without saying that had a significant mental toll on Mark himself. And Mark's actually agreed to allow me to share this. He was quite happy for me to say this at this presentation, but I'm sad to say that Mark actually confided in me many a time during our interview that on numerous occasions he contemplated suicide as a result of this. But, and here's the nice bit about this story, when I spoke to Mark about buying an electronic mountain bike, he said, and I'll read this verbatim because I think this is really powerful, he says, to say it, i.e. buying an electronic mountain bike, was life-changing is quite an understatement, really. Essentially, I then realised I could properly go mountain biking again. I went and qualified for a course that was facilitated by Help for Heroes, which, if you don't know, is a British charity dedicated to veterans of war. Then I went back and I qualified as a trail leader and came back home to set up a club at the school I was working at. On the first day, I expected to get half a dozen lads who would want to go and jump bikes up in the woods, but we wound up with over 50 kids. Now I'm training as a level 2 mechanic, and the scope for the impact that we could have on people is mind-boggling. Essentially, this, again, buying his e-mountain bike, all stems back to me getting an e-mountain bike and being able to start riding again. It's literally saved my life. So, as I hope you'd agree, this is quite a powerful story, and this moved me, this story. But what's the point in me telling you this, and I guess more importantly, how does this relate to the book that I'm punting here? Well, I guess we might be mistaken for thinking about this as being an example of how people are being helped by bikes, or even the technology behind the bikes. We might also be mistaken for thinking that these are just isolated acts of bravery or heroism by people like Mark. But the point for me is that as well as being lovely stories, I think that these instances tell us quite a lot about things like people, about places, about those collective practices and forms of culture, for better or for worse, that might comprise this world of mountain biking that we're talking about today. I think as well, importantly, they also tell us a little bit about the kinds of people that are being left out, as per Julie's story, or underrepresented in these worlds, as well as the types of controversy that mountain bike cultures and practices might entail. So, like many electronic mountain bikers, Mark was telling me in our conversations about how he'd been judged or stereotyped, or in some cases actually verbally abused on mountain bike trails and in the countryside for requiring motorized assistance, because there's a real stigma behind that. Although that's changing, there's a real stigma behind that at the moment in wild, open, or kind of natural spaces. And I think that's a real issue as electronic mountain bikes and other forms of technology become more and more prevalent in the outdoors. So one of the key aspects of this book, as you'll see, is this idea of culture. And I think it's just important to clarify what I mean by this term culture. Because generally, when people are trying to account for mountain biking and mountain bike culture, we tend to think of it through this idea of subculture, which is quite a popular term, really, and has been over the last few decades. It's certainly in sociological analyses of leisure and physical activity. And typically, what a subcultural identity entails is a kind of disenchantment with contemporary fitness cultures that revolve around things like discipline and bodily conformity in artificial environments such as gyms and stadiums. And by contrast, people who are involved in subcultures like mountain biking tend to prioritize certain things, other conflicting things such as informality, grassroots participation over professional participation, as well as things like the artistic aspects of sport or physical activity, rather than those that might relate to more utilitarian aspects, such as competition or winning. Now, to align mountain biking with a subculture might on the surface seem really straightforward, but as some of you here might know today, if you've ever ridden a mountain bike or observed from a distance about what mountain bike culture might be, it doesn't always fit into these really neat descriptions of a subculture for various reasons. So I've taken inspiration from the work of someone called Katrina Mervyn Brown, and she, for example, talks about how mountain bikers have lots of different affiliations, sometimes positive, sometimes negative, with the mountain, in inverted commas. So within these affiliations, we find a whole range of different associations with mountains that can, in some cases, be more or less wedded to certain kind of ideological ideals about what the mountain is. So just to explain that for a minute, I guess, you know, on the one hand, you might get someone like a cross-country mountain biker or a bike packer or a gravel rider, for example, who has a really clear and obvious affiliation with, you know, traditional ideas around isolation, self-dependence, this authentic idea of a wilderness and what it means to escape from the city. We've also got on the other end of the spectrum enduro riders or downhill racers, for example, who are much more inclined towards having a civilized and less romantic idea of what the mountain is, because they tend to receive support from mechanical staff, mechanics, coaches, physiotherapists, and in many cases they'll often use things like uplift services and ski lifts, which are necessarily a form of technology that is intervening in those natural spaces. So that idea of the wilderness and those things that the mountain used to traditionally stand for are very different for those kinds of riders. Then you've got a whole different range of people who mountain bike, perhaps like myself, who don't, if I'm honest, have a particular affiliation with mountains at all. I live nowhere near a mountain. And much of my riding takes place in more suburban areas like Warncliffe in Sheffield or the Peak District, where there's hills but no mountains. But I would nonetheless consider myself to be a mountain biker. So you've got this whole wide range of affiliations, from those who associate with traditional notions of nature and independence and isolation, right through to those people such as myself who have none of those affiliations at all, don't really see themselves as being as part of a subculture, but consider themselves a mountain biker nonetheless. So while it's really tempting to think about everybody as fitting within this overriding culture or subculture of people who, you know, hit massive jumps, smoke weed and slurp cans of Monster, which is often the portrayal of mountain bikers, certainly in the media, I think it's much more poignant or pertinent to think of mountain bikers as consisting of more of like a disparate group of riders, all of whom have different affiliations with different kinds of things at different times and in different places. And at the minute, I guess, to sum this up, I think that this diversity, as I've mentioned, is certainly reflected in the wide range of different affiliations with mountain biking that we get. More so than ever, we've got a massive continuum of mountain bikers, ranging from really competitive cultures of mountain biking that you might see in like cross-country events and cross-country competitions, where people are obsessed with fitness and calorie counting and doing massive distances that are tracked on Strava and GPS tracking devices, right through to those at the other end of the spectrum who ride e-bikes, require assistance, love bike parks, use technology, and are much more interested in going to the pub afterwards and having a good laugh with their mates, rather than focusing too much on the competitive aspects of the sport. So yeah, in the context of the book then, there's this pans out, I guess, or this filters down into a number of topic areas. Now, what I'd normally do is I'd normally do a bit of a pub quiz around, because I've just finished the index for the book, and what was quite interesting was there were certain issues that clearly had an impact on people who were writing chapters for the book. There's 14 chapters overall, and issues were popping up within the book across all of these chapters, which was quite nice to see, because it's clear that whilst we were writing on lots of different topics, there are certain key words, key ideas that were popping up across all chapters. Normally I'd do a bit of a poll to see what people thought, but since we haven't got too many on the call today, I'll just tell you what these were. So the three most topical issues that came up in the index when I was writing it were the media, with 49 mentions, the environment with 47 mentions, and bodies and gender, which came in with a grand total of 46. And these were shortly followed by issues around risk, technology, which is obviously an important factor given controversies around the use of technology in natural spaces. And then by contrast, or maybe similarly, we have issues around nature as well, and how artificial technology, in inverted commas, might have an impact on supposedly natural environments like the Peak District in just on the outskirts of Sheffield. And obviously, as you'll see from the way that the book has been thematized, which is represented in these 4 sub-themes that I've put on the slide here, you can see that these 4 or 5 issues are clearly represented within these sub-themes. So there's 4 sub-themes in the book, as I said, that are on the slide there. And these, in no particular order, were mountain biking identities. So we've got 3 chapters in the book around mountain biking identities. Mountain biking bodies, we've got another 3 chapters on that. Mountain biking environments, or ecologies as they might otherwise be called, and the cultural politics of identity within mountain bike cultures. And this was the one that had the most contributions. We've got 4 chapters in the book on this topic. And if I may, I'd just like to very, very briefly outline the significance for me and for all of the contributors of these 4 themes as they apply to the content of the book. So the first issue then is mountain bike identities. And I think hopefully one of the things my stories at the start were useful in prefacing or contextualizing was that mountain biking identities are important. They allow us to map who we are, but perhaps more importantly, they allow us to map and understand what we do as mountain bikers within mountain bike culture. And I think in my experience over the last decade or so of conducting mountain bike research and being a mountain biker, as well as some of the work I've done for advocacy groups, what I tend to find is that all of those different groups and those stakeholders in mountain bike culture tend to still have a very poor understanding about what that might mean and what the implications of mountain biking identities might be for policy and practice. Now, part of this is due to the fact that our sport is still in its adolescence. It's a very new sport. It's about 50 years younger than a sport like climbing. So we're still trying to figure out what mountain biking is and where it belongs, or maybe doesn't belong. But I think it goes without saying that if we're going to establish ourselves as a community within broader sporting culture and the context of the outdoors and outdoor settings, we're going to have to think a lot more about those wide-ranging mountain biking affiliations that I mentioned earlier on. Now, for me, this could include the voices of coaches, e-mountain bikers, electronic mountain bikers, enduro riders, dirt jumpers, diggers, industry professionals. You've even got these crazy people now that blow my mind who ride around environments like the Peak District and in bike parks on mountain bike unicycles that have one wheel. Mountain bike advocacy has got to do a better job of understanding these affiliations and bringing those to bear on mountain bike culture. And I think increasingly we've got to find nuanced ways of including and engaging everyone, from those whose cultural affiliations do revolve around isolations of the rubric of isolation, wilderness and nature, right through to those that engage more with emerging technologies and emerging identities that come with bike parks and for example, e-bike technology. And it's only by doing this that I think we can promote mountain biking in a way that is useful for other people. Because typically it tends to be the case that in the media, at least, mountain bikers are represented as these idiots, these antisocial idiots who wear hooded jumpers, slurp Red Bull, hit 20-foot jumps and leave litter everywhere. Whereas from my experience, and certainly in the research that I've been doing, that's most definitely not the case. So secondly, we're talking in the book about mountain biking bodies. If any of you have got any kind of orientation within the sociology of sport, you might know that this might otherwise be described through this idea of the affective or affect or embodiment, where bikes, people, experiences come to bear on people's bodies and we experience sport through our bodies. And what this is allowing us to do in this book is it's helping us to understand how riders' sense of things like pleasure, risk, pain, all of which are important, are acted upon through participants or riders' micro-level experiences of their bikes and their bodies. Something that my mate Katrina Mervyn-Brown, as I mentioned earlier, has referred to rather neatly through this idea of the human body-bike hybrid. It's like how the bike and the body work together to formulate or construct a certain sense of space or place. And I think in focusing on how identities, things like symbolic meanings, social expectations are lived out, but at times counteracted by mountain bikers in the moment-to-moment and immediate reactions between body, bike and the lived environment, will be in a much better position as riders, academics, policymakers to understand how certain mountain bike problems, such as crashes or conflicts on the trail, can be influenced by these things. But also, I think these embodied experiences can furnish a better understanding of positive experiences. So why it is that people enjoy mountain biking and how we can use that to have an impact on promoting it in the future. Thirdly, we've got what we've called mountain biking environments. Again, we've got 3 chapters in the book on this. And this is where we collectively argue that we need to dedicate more attention to relationships between social, cultural, and political factors on the one hand, and how these impact ecological conditions and changes on the other. As I mentioned earlier, I've got another book launch coming up, and in that, Tom Campbell, who works for developing mountain biking in Scotland, is going to talk about sustainable trails, and that's becoming a really important issue at the moment, and one that's talked about a lot within mountain biking policy circles. You've got brands like Patagonia and Specialized now. If you're a cyclist, you might recognize these, or even a lover of the outdoors, you'll certainly recognize how Patagonia now are trying to better understand how their clothing and the users of their clothing are having an impact on the natural environment. And it goes without saying that this is becoming a really prominent feature of mountain biking as well. In some of my own research, for example, I've found that trail builders in particular, as you'll see from the slide here, often elicit their own relationships with natural spaces in ways that they're not often given credit for, in that they'll develop relationships with dirt. You know, I've seen mountain bike trail builders with dirt in their mouths, tasting it for how loamy it is, to understand the qualities of it and how it can be best put to use to build a trail, or not in some cases. And there's those anecdotal examples, but there's also examples from institutions like Protect Our Winters, for example, whom I worked with last year writing a report on mountain biking and climate change, where there are anecdotes and examples coming out of studies like that that show us that this is more than just anecdotal, that it can actually have an impact on policy and practice in broader debates about climate change and sport more generally. So to give an example, Dom Winter from Protect Our Winters was telling me that a lot of mountain bikers now are getting more ticks on their legs when they go out riding in natural environments. And this is useful, although inconvenient for mountain bikers. It's useful for those interested in climate change because apparently the rise in ticks on moorland and in places like that has been associated with higher temperatures, and unusually high temperatures that are, of course, then helping to understand the impact that climate change is having on those natural spaces, but as well as the impact it might have on recreationalists, outdoor recreationalists who are using those spaces. So, whilst mountain bikers are frequently, as you may know, accused of damaging environments, causing erosion, destroying landscapes, and I wouldn't dispute that that is sometimes the case. I think the other side of the coin is that the mountain bikers clearly want to look after these spaces that they use, because without nature, without natural resources, without certain landscapes and surfaces, their activities wouldn't exist. They'd cease to exist. So maybe I'm biased, but I would also advocate that mountain bikers do try to look after their environment. And this is certainly something that's coming out of the research in this area as well. Okay, finally, and by no means least, is I think there's a real need to address what I would describe as the cultural politics of mountain biking, the fourth theme in the book. Because as my example of Julie at the start suggests, there's no doubt in my mind at the moment that mountain biking has this accessibility problem. Mountain biking more than ever is encouraging a multicultural and increasingly global range of participants from across a range of international contexts. It's still the preserve of white, affluent, middle-class men, and that's a real problem. Fortunately, there are a lot of people who are starting to talk up about this now. So if you're not initiated into the world of mountain biking, you may not know, but this is a rider, a former professional rider called Elliot Jackson on the slide here. And Elliot Jackson's been a big advocate, for example, for non-white or BAME, perhaps, if we're to call them that, riders, because non-white riders are significantly underrepresented across all mountain biking cultures, from cross-country to enduro and downhill, and that's something that we really need to address moving forward. And what's interesting about this is that one of the things Elliot Jackson advocates, and one of the things he's said on podcasts, is that this isn't just an issue with the economy or people not being able to afford mountain biking. The problem here lies with mountain biking culture. So as well as being really positive about our sport, what this book does, and what I would always point out about mountain biking, is that it does have this darker side. And I think it's everyone's responsibility, both within and outside of mountain biking, more specifically, to recognize this and start asking questions about what minority participants' experience might be of mountain biking, how are dominant sporting identities and practices and spaces mapped on to this sport, and how ultimately might we include a broader range of participants from around the world, including those who come from, those least privileged backgrounds, like the ones that Elliot Jackson here is trying to advocate on behalf of. Okay, so a couple of final thoughts, and then I'll shut up. Just on really what the point of this book is, and where we, and certainly I am going to go from here. The first thing to say is that most existing research now focuses on, understandably, on two things. One is on the economy. And I think, Themis, you've been involved in some research on the outdoor sector, as well as people like Maxine Gregory, Simon Shibley, Larissa Davies, around trying to quantify the outdoor economy, and that's great. The other part of the research that's ongoing at the moment is around the ecological consequences of mountain biking, because there's lots of evidence to suggest, contrary to what I've said, that it can disrupt environments and habitats. But on the other hand, the one thing we don't know enough about, that I think we need to supplement some of that fantastic research that's already ongoing, is an understanding about how mountain biking has a social, cultural, and political significance. And I think there's three key things we need to do moving forward to address that, and I'll keep this brief. The first is that we need to develop more of an understanding of how mountain bikers' identities, activities, and practices intersect with a range of global and local connections. This picture here is from just on the, it's one of the first urban bike parks in Sheffield, that Ride Sheffield were responsible for funding and developing at Parkwood Springs. Some of you might have been there, some of you might not, but this is a really good example about how locally we can use mountain biking to encourage physical activity and get people thinking differently about what sport might be. But at the same time, how this connects with global issues around, inactivity, climate change, maybe encouraging people to ride locally rather than, going up to Wales or Scotland or abroad to engage in different forms of off-road cycling. So I think it's really important to understand how local identities, such as those associated with mountain biking, might be more broadly conceived as relating to global issues like colonialism, climate change, pollution, inequality, and things like that. I think secondly, I would always say, let's not be afraid to imagine and theorize mountain biking. We don't really know what it is yet. I don't think I still have a full understanding about what mountain biking is, and I've been researching mountain biking and riding mountain bikes for a long time now. So I think it's incumbent upon us as academics to try and understand what mountain biking is. And a big part of that is trying to theorize and develop new approaches to this activity, which in many ways has parallels with existing forms of sport, but in many other ways is completely different because of its adolescence to some more traditional and well-established sports and activities. And I guess the final thing to say on this is just that I think we need to seek as many insights, empirical insights, from as many contexts as possible to help us to substantiate some of these claims. I hope that I've done a little bit of this with the book. We've got chapters from everywhere around the world, with the exception of the African subcontinent, which is a shame. We've got chapters from New Zealand, Australia, North America, South America, Great Britain, of course, certain parts of Europe. So we're beginning to build this evidence base, but we need more, because often the problem we have as mountain bikers in justifying our place in the outdoors is not having the evidence to be able to do that. And I think overall, by way of a final thought, I think if we can at least get some way towards understanding these three aspects and implementing these three aspects, we can, despite its very contemptible position within the mainstream, in that mountain bikers are often criticised and treated with a level of contempt, I do genuinely believe that mountain biking and mountain bikers have a lot to contribute to, or in understanding many of the most prominent issues of our time. Okay, thank you very much. I don't know, Themis, if we're doing questions now or at the end, but I'm happy to do that.
Can do it now, so thanks a lot. Is there any question from here or online?
Would it be possible, Themis, just to turn the camera around, just so I can see?
There's not a lot at this moment.
Yeah, just the two of you. I mean, if that's all there is. I've got a bit of a hangover from lockdown, where I don't want to look at a black screen.
Yeah, I'll try that.
Hi, lads.
Donna has the hand up for a question, I assume.
Thanks, Donna.
Jim's probably heard me ask this before, because unfortunately we share an office. But my profile picture here is me having a little walk along kind of Flamborough Head. And whenever I go walking, I'm struck by how many people there are, how much litter they create. And also then, as I'm walking back to the train station or getting the bus, people going down the hill into their huge 4x4s. Is there not a case to argue that mountain biking is less damaging than walking?
Yeah, I think it's a great question, Donna. Thank you. It comes up all the time in these discussions I have with people. And what I'm grateful for is you've asked that in a way that is, quite kind of balanced. Whereas I get a lot of people who, understandably in some cases, really don't like mountain bikers for that reason. But my position on this is, firstly, I think we need to recognize that everybody does damage in certain ways. None of us are really free from we all have an impact on the environment, maybe to greater or lesser degrees, and we've got to take responsibility for that. And the second part of it is, as you say, recognizing that although mountain bikers might do a lot of damage, actually it's all dependent on context and the situation that mountain bikers are placed in. So if you have a group of 30 to 50 walkers on a massive group walk, that group of walkers are going to take up a lot of space. They're probably, in a lot of cases, are going to driven there in their big Land Rovers. You get a lot of dog walkers who leave those nice little presents on trees for us all to look at that are filled with dog dirt. And in that case, yeah, you might argue that the walker is doing more damage, but it's all dependent on context. And the other thing to mention about mountain bikers is that, and this is one thing that often goes under the radar, is that they're doing a lot of good work to help either support environmental agencies or look after those spaces. So a topical example would be Steve Pete's Steel City race, which Nick Hamilton, of course, from Hallam helps to run. If it wasn't for the work of people like Nick Hamilton and Ride Sheffield, that woods that the race takes place in wouldn't be there, essentially, because via relationship with the Wildlife Trust, they raised funds to be able to look after those woods, and that's still something that's ongoing to this day. So I guess there's two answers to that question. One is to recognize, or two parts to that answer. One is to recognize that yes, we do damage, and I wouldn't ever dispute that. But the second is I think we've all got to recognize that we do a certain level of damage and take responsibility for that respectively.
Thank you. Anything else? I would like to, I mean, since you have just leave the camera as it goes, because I cannot stabilize it, but I don't know how to phrase this as a question. About 10 years ago, I met some cyclists. I don't know if some of them were street cyclists, some of them were mountain bikes, and they had a local club near Huddersfield. So I met them in an event. And I think they had a journal called Clarison. I mean, I cannot remember it very well. But what was so striking about them is that they were the children or the grandchildren of cyclists of a club in the 30s and 40s, which split into two parts. And they managed to do that through politics. And it's the only case that I know that this thing had happened. So there was a very close association between the cycling club and the political realm. And that was not, it was not because of cycling as such, it's because of the relationships that the cyclists formed among themselves. So the big disagreement is, and that was from Huddersfield, the big disagreement was, what are they going to do in terms of the Spanish Civil War? Half of the cycling club actually cycled to Spain and fought in the Spanish Civil War, and the other half disagreed that this is not their part, there is not their own fight, they don't have to do that, and they stayed. I don't know whether or not everybody came back, but they were really, it's a recognized part of the Huddersfield history that this sport club actually sent volunteers to Spain to fight, and then they went themselves. And I don't know if, I mean, that was for me a big surprise, because I never thought that the sport club can go into this kind of political realm. But from these conversations, I was certain that the sport itself as a linkage between these people had a big part to play in this political realization. So I don't know if you consider these issues in your cultural politics in terms of tradition and development.
Yeah, fantastic story that, Themis. Thanks for sharing that. It's really interesting. It reminds me of I was reading a Guardian article, I think last year, where a guy was kind of lamenting the disappearance of an old-fashioned form of road cycling culture, because he was saying, he was kind of like very critical of these new age mammals, as we call them, like middle-aged men in lycra who kind of track everything on Strava and wear lycra and take it all far too seriously. He was saying he remembers a time when not only was road cycling very politicized and politically orientated, but it was much more informal, in that I think he was saying that, you know, his idea of a good bike ride was to cycle to the top of the hill with no specific or specialized equipment on whatsoever, smoke a joint and then go home and have a beer, and that would be his day out. But as an aside, I think what I like, and maybe I'm biased either through my own participation or my research, but what I like about mountain biking, and what I would go out on a limb on and say it maybe does better in many cases than road cycling, is it's deeply politicized. It has to be, mountain bikers have to a certain extent be au fait with some kind of political issue, because at some point you're probably, if you're a mountain biker, going to be accused of damaging the environment. You're probably going to be accused of being in a space when you shouldn't be. You're probably going to be accused of using something artificial in a natural environment, which necessitates an engagement with issues like pollution, climate change, the future of our planet. So what I think is really useful about mountain biking compared to other cycling cultures, maybe even more different sporting cultures, is that it takes us back to that world that you were describing. It has to be necessarily deeply politicized, because everything you do as a mountain biker is part of that debate.
Okay. Thank you very much.
Thank you.
So if there's nothing else, we can continue with the second speaker.
Thank you. Nice one, guys.
Can you stop sharing now, Jim?
Yeah.
Hello, everyone. Let me just find my slides. Can everyone see that? Okay, 1 second. There we go. Is that still showing on there? Yeah. Okay, great. So yeah, good afternoon, everyone. We're going to take a bit of a right angle turn from the presentation we've just seen. So thanks, Jim, for your really good presentation. This is slightly different in terms of content, and also slightly different in the fact that I feel like your work's quite well developed, and the fact that you've got now to the stage of writing a book means that you must have done a lot of work on this, whereas this work that I'm going to present today is very early stages. So bear with me because there's still lots to do, but it's just, I felt this was a good opportunity just to kind of start talking about the work that we are planning to do, the early work that we have done, what we plan to do. So my name's Dr. Mike Thelwell, and I'm from the Sports Engineering Research Group that's part of SPARC and situated at the AWRC. And I'm going to be talking about a project that I'm currently working on as part of a ECR fellowship, which is all around using advanced body measurement techniques, specifically things like 3D body scanners, and can we use the data that we collect using these systems within chemotherapy dose prescription. So just in terms of some background, so you may or may not be aware, but so cytotoxic chemotherapy, or chemotherapy as it's more commonly known, is a mainstay or is used regularly within cancer treatment. It's one of the mainstays that has been used for going on for 70 years now. There are new forms of treatment, such as immunotherapy, targeted therapy, hormone therapy, which are gaining a lot more traction and being used much more regularly. However, traditional kind of cytotoxic chemotherapy is still being used very regularly and will be used for some time. So making small improvements in this area are still warranted. And at the moment, when prescribing dosages for how much chemotherapy you receive as part of your treatment, the main measurement that's used, or the key variable, is something called body surface area. So this is just how much surface area you have on the outside of your body, or your skin, basically. And this is based on research that was done probably over 100 years ago now, where they were looking at how drugs are metabolized in rats, and then they transferred that knowledge into humans, and they saw it as a reasonable variable or measure that relates to how your body can metabolize these chemotherapy drugs. However, this measurement, body surface area, has been heavily criticized in recent years, and calls for new measurements or new ways to measure the body to prescribe drugs have been getting louder and louder. So there's lots of reasons that they criticize this measurement. So it's not representative of patient variability, because things like body surface area, BMI, which you'll also be aware of, though they're relatively good overall measures of the body, there's lots of interpatient variability, interperson variability that they don't account for. So variations in body composition, for example, it can only measure the overall size of the body, not the shape and how mass is distributed within the body. So it just has lots of limitations. And in its early development, I think I'll talk about it a little bit more in a couple of slides' time, but the formula that they used to estimate body surface area was developed on very small homogeneous sample size samples of white middle class males, basically, which is not representative of the UK and the global population that we live in today. So lots of criticism for it, and rightly so. And again, something else I'll talk about in a couple of slides' time, but getting dosaging right is really, really important because it can affect how effective the treatment is, so how much of an anti-cancer effect it can have, and also the tolerability of the treatment, so how well do patients deal with it, because particularly within chemotherapy, you're putting drugs within the body that is killing cells, both cancer cells and healthy cells. So it's you've got to be able to give them a dosage that they can actually tolerate without affecting them too much, so that they go down the other side, if you see what I mean. So there is definitely a need for improved methods of how we calculate these dosages, and it remains a significant challenge within oncology. As I said, they're going to keep using these types of treatments into the near future. As I mentioned before, so there is probably an optimum or a kind of perfect dosage that we're always trying to get as close towards, and that optimum dosage will give the maximum anti-cancer effect alongside an acceptable level of toxicity for the individual. I think when they're calculating these dosages, they're often more interested in avoiding excessive toxicity caused by overdosing, because obviously you don't want to be poisoning someone essentially by giving them too much of these chemotherapy drugs. However, research has shown that inadvertent underdosing is actually more common and can affect as many as 30% of patients who are receiving standard chemotherapy regimens. And that's possibly even more of an issue, because you don't want to be, if you're giving them these types of drugs anyway, you want to be given having the most effect, or getting rid of as much cancer as you possibly can. So the image at the bottom there this is just a representation of how they perform their clinical trials. So the 1, 2, 3 on the left-hand axis is just showing different levels of the dosage for any new type of drug, and there is a target range in the middle there where you're getting the maximum amount of anti-cancer effect and an acceptable level of toxicity. And in this figure, they would typically go for the dose level 2 that's on there, because you've got the effect against cancer being in that target range. However, the issue with that is that the majority so each of the dashes on each of those horizontal lines represents an individual. Most of the people in that group are getting an ineffective anti-cancer effect from the amount of dosage that they're getting, even though some of them are in that target range. So ideally you'd be getting all of your participants in that kind of quite tight target range in the middle, rather than being either too far on the left-hand side or too far on the right-hand side in terms of their dosage. Yeah, as mentioned a couple of slides ago, this is looking a bit more into body surface area as a measure itself. So using traditional body measurement techniques, so lengths, widths, height, weight, those kinds of measurements, you can't actually measure body surface area directly. You have to estimate it using one of several estimation formula. And there's a table on the right there which shows a selection of these existing formula that are currently used. There's, I think, somewhere between 20 and 25, 30 of these different formula. They all basically are based on a nonlinear function of simple measures, height, weight being the predominant ones, with some factors and parameters added in there as well. One of the earliest of these was by Dubois in 1916, so over 100 years ago now, and that still remains the standard approach to estimating body surface area within current practice. You'd think that we'd have thought of a new measure now after 100 years, but it's still the most commonly used one. Yeah, there's been no real. They have started to do some more recent studies to try and iterate on these equations, but actually not a whole lot has been done to change them in all this time. And one of the key limitation you can see, if you were to calculate body surface area for one individual using all of these different equations, their estimate of body surface area can vary by as much as 0.5 meters squared for the same individual, and actually can exhibit quite large errors from a direct measurement of body surface area collected using a body scanner, for example. So it's just showing that though these measures are starting to get outdated, they're quite simple and limited in what they can provide, and actually they're not very accurate in what they're trying to measure anyway. So that's just some of the issues with current practice. One of the other big factors within there is obesity, and numbers of patients going through treatment who are living with obesity is actually becoming more common, just in line with the general population as well. And not only is obesity a risk factor for developing cancer, but obese patients tend to have worse outcomes as well in terms of their overall survival than patients who aren't overweight or obese. And this is because obesity and kind of subsequent variations in body composition can cause quite large variations in how people metabolize or clear these drugs from their system. So that's one of it. And as I mentioned previously, it's those type of variations that these quite simple measurements, so BMI, body surface area, aren't able to identify as well. They kind of try to average out individuals, where it's these people who are at the extremes of body type. These are the ones that we're trying to better cater for, where they'll be underserved by current methods. And they can quite often reduce confidence of practitioners when they're determining dosages. So they tend to, for people who are at the higher end of body weight, they'll reduce their chemotherapy dose, or they'll cap them at 2 meters squared in terms of their body surface area in attempts to avoid excess toxicity from their treatment. However, recently, ASCO, the American Society of Clinical Oncology, published guidelines that said that obese cancer patients shouldn't be capped, and they should be treated using standard dose prescriptions, the same as other patients, just because of what they've seen in terms of their tolerability of the treatment and better overall survival rates, which is interesting. But that still is standard practice, that they will cap obese patients. So I think it has been suggested that further research to assess appropriate dosing strategies for people with increased body weight is still needed to be able to give practitioners these actual evidence-based recommendations, rather than just winging it on what they have seen and experienced. So advanced body measurement techniques, I think I've presented in this forum before, and you've heard from my colleagues as well, around about advanced body measurement techniques, in particular modern digital tools such as 3D imaging devices or 3D body scanners. Firstly, it can measure body surface area directly. It doesn't have to estimate it using these regression formula that you have to use when you're using traditional body measurements. But it can also give you additional measures of body shape, and that can give you additional information about these interperson variations that I mentioned before, which you can't obtain using these traditional measures. So we can look at things like curvature that's present on the outside of the torso. We can see how mass is distributed around the body. And we've actually been able to show in a couple of previous studies that we can better predict both quantities and distributions. There was supposed to be another figure there. We can improve prediction and quantities of fat within the torso using our new, more sophisticated measures of body shape. And this is why we feel, or our hypothesis is, that if we use better measurements of the body and other analysis techniques, that we can have a potentially viable alternative for practitioners to calculate more individualized chemotherapy dosages in practice, rather than just relying on these quite tired and limited regression equations that we've been using for over 100 years now. And so with all that, I feel like we've just done a whistle-stop tour of the background there, but I've recently been awarded an early career research fellowship, which started, I think, a couple of weeks ago. And the aim of that fellowship is to conduct a significant piece of research to investigate improved methods of determining cytotoxic chemotherapy dosage using more advanced body measurement techniques. I need to think of a more easy way to describe what the research is that isn't so much of a tongue twister. But yeah, that's basically what the aim of it is. It's to start looking into more detail. How can we measure the body and help practitioners make informed decisions about how to dose chemotherapy? Within that fellowship, I've got quite a few planned activities. Plans to do retrospective analysis of existing data that we already have. So we have access to data from Sheffield Teaching Hospitals, but we've also been granted access to data from UCL, so University College London, to look back at patient data that we already have. So in terms of what doses they were prescribed and any alterations or reductions in doses that they happen to go through. And we're quite interested to look into that in more detail to see whether individuals of an elevated body weight had higher rates of reductions, for example, and what the errors were in their body surface area estimations. We are planning to do a prospective data collection with patients who are currently undergoing chemotherapy, because we're quite interested to see how alterations in dosage relate to these errors in body surface area that we know are happening for people of different body masses, different body compositions, as well as collect and calculate novel body measures and see if we can add those into these regression equations or come up with new equations altogether that could help inform future developments of dose calculation methods. Plan is to expand my external network and engage with academic and clinical partners within oncology, with the overall goal of being, if I can collect this new data, perform this historical data analysis, position myself to submit a major funding application by the end of the fellowship. So by the end of this year, hopefully submit a large grant application. And so just to talk about what we've done already. So we have the first paper currently under review. I've just been working on the revisions the last couple of days. So I'm hoping that this paper will come out relatively soon. And this is just an opinion piece, which basically is an overview of the background that I've just talked through just now. Just basically talking about the limitations of current methods and how we could use these advanced body measurement techniques within dose prescription. So watch the space for this first paper. The retrospective analysis. So as I said, we've got access to a couple of different data sets. And the main purpose of that is to demonstrate these variations in body surface area for different individuals of different body types. So we're going to have about 6 months worth of data from SDH and around 900 patients worth of anonymized data from UCL, just to look at those relationships between errors in body surface area estimation using current methods and their kind of clinical outcomes. So that's hoping to have maybe a conference abstract out of that, as well as a paper. I have done, because I have data already from previous studies, so I have access to around about 10,000 individuals from a study conducted in Germany. And this was just a quick example that I did when I was having these conversations with external partners. So what I did here was I used just the male data that I had, so around about 4,500 people. I calculated their body surface area using 5 different existing regression formula. And then I separated the individuals out into their different BMI categories, as you can see on the figure here. And as you can see, if you go along the x-axis, these are the different BMI groups. And as an individual's body weight or BMI increases, the variability in their body surface area estimates increases. As you can see, the boxes get higher up on the y-axis. And it just shows that as your body weight is increasing, the error associated with this estimation gets worse. So that's kind of early but this was in an asymptomatic group, so or a healthy population. So what we're hoping with this additional retrospective analysis is that we can actually link, so again, demonstrate these errors in the estimation, but then link it to their clinical outcomes as well to see if it is actually affecting their tolerability of their treatment and their overall survival as well. The prospective data collection that I've got planned. So the plan is to collect data from around about 50 patients who are currently receiving chemotherapy here in Sheffield. And we're actually going to focus on patients with breast cancer in this first study, just because we've got quite good links in with that group at the hospital. And also we found, or from discussions, breast cancer patients' weight tends to be relatively stable as they go through their treatment compared to other tumor sites. So upper GI cancer, for example, they'll tend to lose quite a lot of weight, because one of the things we're going to be collecting data from them at a single instance. So they're going to come to the AWRC. We're going to collect external 3D imaging data as well as body composition data using a bod pod, as shown on the image there. But we're also going to be getting their clinical data from Sheffield Teaching Hospital, so their prescribed dosages, any dose reductions, as well as medical imaging data collected during cancer staging. So it'd be nice if we had people who are relatively stable in body weight and body composition during treatment, so that if they were to come to us, if they've already started chemotherapy, that wouldn't affect the measurements so much. So that was just one of the reasons why we made that decision. And again, similar to the retrospective analysis, we want to demonstrate these discrepancies or errors in body surface area measurement, but also collect some preliminary data that we can use to help inform further developments of these body surface area estimation methods, but also new ways that we can measure the body to determine dosage. In terms of progress on that, we attended the rec review meeting this Monday, Monday just gone. And so that's the NHS Ethics Review Board. So I'm hoping it seemed to go quite well on the day. So they're going to send us their review in the next day or so. And so once we've got NHS ethics approval, we can get going and start collecting this data. And that's pretty much it. That's where we've got to. I'd be really happy to take any questions, and if anyone has any suggestions, I'd be happy to take them. So thanks very much.
Very much.
I've got one.
Okay.
Sorry, Mike, you're not going to like this. I'm curious about the choice of looking at breast cancer. I understand it. I just checked the stats myself from breast cancer here, and this is something. By gender.
Well, it's likely to be predominantly women in the study for sure, but it's not to say that not all breast cancer patients are women. Whereas you'll have similar discrepancies in other cancer sites. So upper GI cancer, for example, is predominantly males. So whichever tumor group we'd have gone for, we probably would have had a discrepancy between genders. Obviously, we could have had multiple tumor groups, but this is a small pilot study, and the hope would be that building on this small pilot study, we can do larger data collections across different tumor groups and look for differences between those as well. That is the hope.
I mean, I'm just going to be interested to see if there's differences across genders as well, because from previous research we've done, we know there's different challenges with the different genders. So,
for sure. Thanks for that, Jen. I don't know if anyone else has.
Mike, I have a question, Mike. Thanks for the presentation. I was just writing a few numbers down, but I think I might have got them wrong. I thought you mentioned that it's around body surface area. Did you mention discrepancy of 0.5 meters squared?
Yeah.
Which sounds. I mean, that sounds. I'm just trying to judge it. It sounds vast. But then, what a typical. You showed a graph, but unfortunately on my iPad it was too small for me to read the y-axis. What are typical body surface areas? Are they like points? What's a typically large body surface area? About 0.7.
Well, no, so it's you'd probably be looking at some 1 point something usually.
Right.
That's why
Okay.
they'll usually cap an individual at 2 meters squared. So
Right.
that would represent a larger individual. Anything above that.
I see. But still, a huge percentage-wise, still a huge percentage error. Yeah. Because of course we talk about next generation BMI. It was the first time I've really heard. Obviously, not caught up recently, but in terms of it's the BS8 body surface area measurements that they're actually basing it on rather than BMI.
But
not really interesting.
But because of the measurements that are in there, you are essentially talking about BMI. It's height and weight.
Of course.
So same issues.
The calculator uses those as its inputs to then measure that whatever the actual BSA is that it's measured. And I don't know if anybody else have any other questions. Could I just ask you to share your slide deck? Only because my memory's bad. Would you? Is that okay? I don't know if I can't see anybody else holding up the hand. Can you just go through just about halfway through? So just click on a few slides. There's just one particular. It's about the study. So just keep going. So no, it's more about this. No, keep going. About the perspectives. Maybe next. Oh, was it this one? Gosh, I wish my memory was better. Maybe go back one. Sorry, go back. Just keep going back. Go back. It says when you mention it's on that second bullet point. How alterations in dosage relate to errors. How do you implement that kind of intervention? How do you look at how alterations in dosage? Surely that must be really difficult to control, is it? Or to have any control?
So we won't be. So this is the alterations would be any adjustments they'd have to make as they went through treatment. So they'll typically, based on how much toxicity someone's suffering from, they'll bring the dose down. In practice, they don't tend to raise the dose. So if someone's tolerating the chemotherapy quite well, they won't say, "Oh, we'll up it next week." They'll say, "Oh, you're tolerating it fine. We'll leave you at that one." It tends to be that they'll reduce dosage if someone's having too much toxicity. But we're not, as the study, we won't be saying, "Oh, you need to change this person's dosage."
I see. Yeah.
Possibly in years to come, if we're doing a randomized controlled trial or something, that might be part of the study. But at the moment, it's just observing what's happening.
Yeah, I see you monitoring it rather than actually making those changes. I see. No, thank you. I don't know if anybody else has any other questions.
Anyone else?
Mike, following up from this point, if you just monitor the changes in the treatment, can you really say something afterwards about what is the optimum treatment? What is the optimum dose?
As I said, so I don't think at this stage we aren't saying this should be the dosage. We'll be collecting the data using the 3 body scans. We'll be doing some analysis on that to see if we can, one, get a better estimation of body surface area. We can do that relatively early on, but also see if we can get other measures of body shape, add those into the equations and see if we can get a measure. And we'd have to do further studies from that to see if we affect dosages based on these measurements that we can collect. Can we get something that gets you close to that optimum dose? So does it give you a higher level of anti-cancer effect without causing excess toxicity for those people at the extremes? Because it seems to be the measurements they currently use work quite well if you're kind of a standard body type of a certain ethnicity. That works quite well. But it's those people who are at the extremes of body type. So there's overweight is what I've talked about, but underweight also is sometimes an issue. So people who are suffering from sarcopenia, who are losing lots of muscle mass, for example, they'll be adversely affected as well based on these current methods. Yeah. All good?
Good, yeah.
Do you want me to stop the recording?
Yeah, I'll just mention
Okay.
about next next.
Thank you.
Thank you very much. Okay. So thank you very much. You speaker. Okay, thank you very much for attending. Next time we're going to have two speakers from the University of Sheffield. The first one will be Dr. Miles Jones for neuroscience, and the second one, Dr. Mahnaz Arvaneh from computer science. So it will be much more technical presentation. I hope that will be interesting to many of you, and see you then. The next presentation is on the 30th of January. Okay, so thank you very much. Bye.